Well, here we are at 8 o'clock. So, welcome everyone. I'm delighted to have you with us today. I'm Deb Dietz of SMB Digital Education. Welcome to our second of 4 webinars on COVID-19. Today, we'll be sharing details and answering your questions about bringing your baby home from the hospital. If you haven't registered for our 2 remaining COVID webinars, we would love you to join us. Those are on February 24th, where we'll be discussing isolation and anxiety. And the last webinar is on March 10th, and we'll be discussing vaccines, yes or no. And I'll provide the link for you to register at the end of our time together. We'll also have a question and answer session at the end of Pam's presentation. So please use the Q&A Zoom bar to log your questions, and we will make sure that Pam has an opportunity to answer them at the end of our time. We're also streaming live on Facebook right now, so please text your family and friends. Let them know that we are live and to watch us. Our Facebook page is Raising Confident Parents. You're welcome to take notes, but we're also recording this webinar tonight, and you will receive the replay in the next day or two. But now I'd like to introduce our pregnancy and infant care expert, Pam Jones. Hi, Pam.
Hi, how are you?
Great to see you tonight.
You too.
Pam has been a registered nurse for over 25 years, specializing in maternal child health and parent education. She's a certified pediatric sleep specialist and consultant and founder of the traveling Sweet Dreams Little Ones Sleep Agency, meaning that she does travel. She will travel to your home and she will help you with your baby. Pam's also a certified parent educator. She and her sister, Pat Pori, are the co-authors of the best-selling book, Raising Confident Parents, Secrets from Baby Nurses and Parents About Pregnancy, Infant Care, and Achieving Sweet Dreams.
Thank you, Deb.
So, that's all about bringing your baby home from the hospital. And this should be, right, an exhilarating and joyous occasion, but it can also be a bit strange and daunting time for many new parents. And in the times we're living in, uncertain, unprecedented times of social distancing and self-isolation, it's understandable that many new parents can feel more alone than ever before. Anxiety surrounding bringing your newborn home is completely normal. That's just being a good parent. But in the midst of the ongoing pandemic, those concerns are heightened exponentially. But if you're taking the precautions that Pam will be sharing with you tonight, you'll be well on your way to preventing the spread into your homes and keeping baby and your family members safe. So Pam, share with us what we need to know.
All right. So yes, as Deb said, this is definitely a different time for women to be pregnant and to be bringing your baby home. We know that it can be very frightening, a lot of questions unanswered, confusing information for everybody. So that's why we decided to do these free webinars to try and get some understanding of all the information that's out there, and try and make you feel a little bit more comfortable with the current information that changes daily. So we wanted to just try and let you know that we're here with you, we hear you, we know that this is really a difficult time. That is also such an exciting, wonderful time. And we want to be with you every step of the way to help you get through it and enjoy it as best you can. Unfortunately, this is not one of my favorite types of webinars to do, but it is important. So we felt it was really important to get the information out there and hopefully have a little bit less confusion than people have had in the past. So unfortunately, I'm going to start with the US cases and deaths so far from COVID-19. According to the CDC, as of January 22nd, 2021, around our first webinar, total reported cases in the US are 24,512,618. As of February 8th, just a bit over 2 weeks later, the cases in the US are 26,852,809. According to the CDC, as of January 22nd, 2021, the reported deaths in the US were 408,697. Just over 2 weeks later, February 8th, the deaths in the US are 462,037. Our thoughts and prayers go out to everyone that's been affected by this virus, has lost family members, and has been really sick themselves. And we just really can't thank all the healthcare workers and EMS providers that have been helping, the teachers that have been going to work, and all the people everywhere, the essential workers that have been going out there, putting themselves in danger, the police officers, the fire department, everybody that's tried to help all of us to continue to get through this. So thank you, thank you, thank you. The first COVID-19 vaccine was given on December 14th, 2020. Our first sign of hope. As of February 8th, 2021, 42.4 million vaccines have been given. We have a long way to go, but at least we're on our way. People have to sign up for vaccines. They have to help other people register that don't have computers, that are not sure how to get registered and are in high risk categories. Please help them get registered, and let's try and get anyone that would like the vaccine to be able to get the vaccine. We'll talk a bit more about that. We do have some more information. As we said, that our first webinar was about staying safe while pregnant during the pandemic. And so if you were not able to watch that webinar, we have it recorded, and you can email me at pam@sweetdreamslittleuones.com. That'll also be at the end, and I will be happy to email you a recorded copy of that webinar. So how to stay safe. Some of the things that we can do to try and maximize our safety as much as possible. Nothing's 100%, but right now, this is what we have to work with, and we all need to do it. Stay at least 6 feet, about 2 arm lengths, away from other people. Cover your nose or sneeze with a tissue, then throw the tissue in the trash and wash your hands. If a tissue is not available, turn away from people and cough inside your elbow. When in public, wear a mask over your nose and mouth. Make sure that the mask fits you so it's not always sliding down your nose. You want to make sure that it is a tight fit over your nose, covers your nose and your face at all times, doesn't have big gaps on it. And we want to make sure that it's working properly. Try not to touch your eyes, nose, or mouth. Clean and disinfect frequently touched objects and surfaces. Disposable face masks should not be reused, and cloth masks must be washed after each use. If you're at high risk, you can wear double masks as long as you're able to breathe easily. Surgical masks are preferred due to their 3 layers of protection. Stay home when you're sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. If we all did this from the very beginning, as my 7-year-old granddaughter says, this sickness would have been gone by now. So my 7-year-old granddaughter is smarter than a lot of us. Protect your baby. Get your recommended vaccines. Getting the recommended vaccines during pregnancy against the flu can protect you and others living in your household should you also get the flu, and get vaccinated to protect themselves and you. So everybody living in your household should make sure that if they don't normally get the flu, if they don't have any allergies, this is a really good time to ask them to get the flu, especially if they're living in the same house with you and you're pregnant or you're bringing home a new baby. Also, a must-do vaccine is called a Tdap. It's for whooping cough. Some people will call it a tetanus, but it's not the tetanus vaccine. It's for tetanus, diphtheria, and pertussis, which is grown to be very common, more so now in the last 10 years than it was before. And it can really make your babies ill. We used to give moms after they delivered the Tdap vaccine. Now, doctors are actually, over the last few years now, giving moms the vaccine at about 37 to 38 weeks. That's how important it is, because they're wanting the vaccine to get the antibodies to the baby to protect the baby some from whooping cough after they're born. So that's how dangerous it is. And it can be even fatal to your baby. So anyone who's going to be in contact with your baby needs to get the Tdap vaccine at least 2 weeks before the baby's going to be born or before they're going to be in contact with the baby. And they have to remember the babies come on their own timeline. So there is no such thing as getting the Tdap too early. If they got it 2 months before you're due, that's fine. And usually you only had to get the Tdap every 10 years. Now they're recommending every 5 years, but pregnant women will get it with every pregnancy. Try and keep at least a 30-day supply of prescriptions and non-prescription medications at your home. Talk to a healthcare provider about getting an extra supply, for example, more than 30 days of prescription medications if possible, to reduce your trips to the pharmacy. Call your healthcare provider if you have any concerns or if you get sick and think that you may have COVID. Do not delay getting emergency care because of COVID. If you need emergency help, call 911 right away. Tell them that you've just delivered and are having an emergency. If someone else is driving, call while you're on your way. If you need to drive yourself to the emergency department, call before you start driving. On that note, I would call 911 and have an ambulance come if there's any way possible before you drive yourself. This is something that I think every new mom should have done. I think it's a great hint that you can give to your partner while you're in the hospital, to have someone else come and deep clean your house. Now with COVID, of course, we're really deep cleaning, doing things that we wouldn't necessarily do before. But even when COVID's gone, I think it's a great gift. I'd say forget the push gift and just make sure I come home to a clean, spotless, organized house when I come home with my baby. Because your partner will say, I'm taking care of it. Oh, it's going to be great when you come home. But you know, they're taking care of it and you're taking care of it is a little bit different. So just have it set up, give them a really good hint that that's what you want for a gift before you come home. Have it set up that someone will come and clean your house. And so, bringing your baby home to a clean house is obvious, but there are many important objects and places overlooked that we need to look deeper at now with COVID. Be sure they disinfect every surface that hands frequently touch, including doorknobs, drawer handles, toilet flush handles, sink and bath faucets, countertops, and cabinet pulls. Studies have shown that the coronavirus can live on stainless steel for up to 48 hours. So we do have, they have to be a bit more diligent now. Also, be sure they disinfect the inside of your car, paying special attention to door handles inside and out, control buttons, and steering wheel. If you live in an apartment building, wash your hands thoroughly after opening common doors or riding the elevator. Symptoms of COVID-19. People with COVID have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID: fever, chills or cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. So any of these symptoms can be your way of showing that you have COVID. So unfortunately, not many symptoms can be ignored right now. Caring for your newborn if you are diagnosed with COVID. If you are in isolation for COVID, take the following precautions until your isolation period has ended. Stay home to separate yourself from others outside your home. Isolate, stay away from other household members who are not infected, and wear a mask in shared spaces. CDC does not recommend the use of a face shield as a substitute for a mask. You can wear a mask and a face shield for increased protection if you're more comfortable, but they don't want you just wearing a face shield and not a mask. If you're not feeling well, have a healthy caregiver who is not at increased risk for severe illness provide care for your newborn. Caregivers should wash their hands for at least 20 seconds before touching your newborn. If soap and water are not available, use a hand sanitizer with at least 60% alcohol. If the caregiver is living in the same home or has been in close contact with you, they might also have been exposed. They should wear a mask when they are within 6 feet of your newborn for the entire time you are in isolation and during their own quarantine after you complete yours. Watch for emergency warning signs. When to seek emergency medical attention. Look for any emergency warning signs. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing or persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. This list is not all the possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19, so they're prepared when they come to your house. Have their doctor's phone number on hand and call their doctor if the person keeps getting sicker. Breastfeeding and COVID-19. You may find it harder to start or continue breastfeeding if you have COVID. Here are some helpful tips. Frequent hand expression or pumping will help you establish and build your milk supply if you're separated from your newborn. This means if you're in the hospital and you decide, you're not feeling well and you want the baby to not room in, but to go to the nursery, you may not have that continuous breastfeeding to stimulate your milk. So if you don't, then you want to pump or feed every 2 to 3 hours. Oh my gosh, my fire alarm is going off. That happens when, I try and cook. That's why I don't cook. Pump or feed every 2 to 3 hours, at least 8 to 12 times in 24 hours, including at night, especially in the first few days. This helps the breast to produce milk and prevents blocked milk ducts and breast infections. If you're feeling okay while you're in the hospital, even if you do have COVID, you can talk to your doctor about the baby rooming in with you. And they will tell you the same precautions. Wash your hands before you touch the baby, wear a mask when you're in close contact with the baby within 6 feet. But most doctors will allow you to room in with the baby in the hospital and breastfeed as long as you're feeling up to it. If you're unable to start producing milk in the hospital after birth, or if you have a temporary stop breastfeeding during your COVID illness because you do not feel well enough, get help from a lactation support provider. If you have COVID and choose to express breast milk, use your own breast pump, not one shared with anyone else if possible. Wear a mask during expression. Wash your hands with soap and water for at least 20 seconds before touching any part or bottle parts and before expressing breast milk. Follow recommendations for proper pump cleaning after each use. Clean all parts of the pump that come into contact with your breast milk. Consider having a healthy caregiver who does not have COVID and is not at increased risk of severe illness from COVID and is not living in the same home. Feed the expressed breast milk to your baby. If the caregiver is living in the same home or has been in close contact with you, they might have already been exposed. Any caregiver feeding the baby should wear a mask when caring for the baby for the entire time you are in isolation and during their own quarantine period after you complete isolation. Keeping your baby safe and healthy. While much is still unknown about the risks of COVID to newborns born to mothers with COVID, we do know this. COVID-19 is uncommon in newborns born to mothers who had COVID-19 during their pregnancy. Some newborns have tested positive for COVID shortly after birth, but it's unknown if these newborns got the virus before, during, or after birth. Do not put a face mask or a face shield on your baby. Children younger than 2 years old should not wear face masks or face shields. A face shield could increase the risk of sudden infant death syndrome, SIDS, or accidental suffocation and strangulation. Babies move around and their movement can cause the plastic face shields to block their nose and mouth or cause the strap to go around their neck. Safe sleep for your baby. Even without COVID, we always want to ensure safe sleep, but especially at these times, some other factors can come into play. During the COVID-19 pandemic, parents may be extra stressed and tired. Making sure parents and babies get enough quality sleep is very important. Take steps to reduce the risk of sudden infant death syndrome and other sleep-related deaths by doing the following. Place your baby on his or her back for sleep at all times, for naps and at night. Use a firm, flat sleep surface, such as a mattress in a crib, covered by a fitted sheet. You can also use a bassinet next to your bed. Have the baby share your room, but not your bed. Your baby shouldn't sleep on an adult bed, cot, air mattress, couch, or chair, whether he or she is sleeping alone, with you, or with anyone else. Keep soft bedding such as blankets, pillows, bumper pads, and soft toys out of your baby's sleep area. Do not cover your baby's head or allow your baby to get too hot. Signs of that your baby may be getting too hot include sweating. You'll see little beads of sweat on their nose or their forehead, or his cheeks or chest may feel hot. A lot of times I'll touch the baby's feet, and if they're hot or if they're cold, that's how I kind of gauge the temperature. Do not smoke or allow anyone else to smoke around your baby. Should my baby or children get their regular scheduled immunizations during this pandemic? While COVID is disrupting our daily lives, the short answer is yes. Do try to get your child vaccinated where services are available. It is important that children and babies keep their vaccinations up to date because they protect them from serious diseases. It means that when your children can return to interacting with other children, they'll have protection from some other diseases too. If you're unsure of whether or not your immunization services is still running as usual, please check with your healthcare provider. Because the COVID situation is changing every day, you might find that healthcare providers will be adjusting their way of providing care as things change. If you cannot get to a clinic when your child's next vaccinations are due, make sure to make a note somewhere to try again as soon as the services resume. Know the possible signs and symptoms of COVID-19 infection among babies. Most babies who test positive for COVID have mild or no symptoms. Severe illness in babies has been reported, but appears to be rare. Babies with underlying medical conditions and babies born prematurely, earlier than 37 weeks, might be at a higher risk of severe illness from COVID-19. Reported signs among newborns with COVID include fever, lethargy, being overly tired or inactive, a runny nose, cough, vomiting, diarrhea, poor feeding, and increased work with breathing or shallow breathing. If your baby develops symptoms or you think your baby may have been exposed to COVID, get in touch with your baby's healthcare provider. If your baby has COVID, emergency warning signs such as trouble breathing, seek emergency care immediately. Call 911, but do notify them that your baby has been exposed to COVID or is having symptoms that may be COVID-19. So again, they can take the proper precautions when they're coming to your house. Moms and or caregivers need support. Not only have you been through this 9 months of a whirlwind, trying to keep you and your baby safe, you've been in the hospital and dealt with that, you're exhausted. Now you're coming home. You may be sick with COVID, your baby may have COVID, someone else in your house may have COVID, or your other children may have COVID. So don't be afraid to ask for help. We all don't have to be superwomen. Trust me, you want help and you need support. Ask someone, whether it's your partner or someone that's healthy in your home or a friend, to help with cover basic needs. Make sure that the person who is sick drinks lots of fluid and rests. Help the person who is sick follow their doctor's instructions for care and medicine. These people that are sick may have high fevers, which can affect their memory and not really remember when they took their last medicine. So I always like to write a list, what time the medications are due, have them out, check off when they're taken, because even if you're not sick and you're just a caregiver, you will forget. So for most people, symptoms last a few days, and people usually feel better after a week. See if over-the-counter medicines for fever help the person feel better. Make sure the person who's sick drinks a lot of fluid and rests and stays away from contact with other people in the house. Help them with grocery shopping, filling prescriptions, and getting other items they may need. Consider having the items delivered through a delivery service, if possible. Most people, even a mom that's sick with COVID and should be able to and can ask for and get away with anything she wants, will still not ask for help. Because again, we have to be super women. So see what she needs. Try and guess what you might need in that same situation and just bring it. Just do it, just give it, because the chances are they won't ask for it. So doing things like taking care of their pets and limiting contact between the person who is sick and their pets when possible. More moms or caregivers may need help continued. Rules for your hired caregiver. So if you have hired someone to come into your house because you're sick or you need more sleep or you need help, as you will, make sure that they're following the guidelines that the CDC has put out for any caregivers that are caring for your children or your babies. The CDC guidelines state that care providers must be updated on all vaccinations to minimize the risk of influenza, the flu, pertussis, which is part of Tdap, the whooping cough, MMR, which is measles, and other illnesses to which newborns may be susceptible. Hand washing should continue to be an essential habit. Wash hands for 20 seconds with soap and water. Upon entering to the family's home, prior to food preparation, after going to the bathroom, before and after changing diapers or attending to the children, help the kids in your care do the same. Get them used to washing their hands and make sure you see them wash them. Remove your shoes upon entering the family's home each day to prevent any cross-contamination between homes. Some more rules. The Center for Disease Control and Prevention suggests you wear a mask over your nose and mouth in combination with physical distancing, hand washing, and everyday preventative actions. Masks protect others more than they protect you. So it's a good idea if everyone working together in the home, excuse me, with the exception of children under 2 years old, wear masks. Use antibacterial wipes or gel, bring some with you, or make sure the home has some for you to use. If it's possible, stay in a designated area of the home with the baby, so that you can contain everything, clean everything thoroughly often, and you're not really spreading germs throughout the house and having more contact with other people that may not be necessary. Prioritize disinfecting high touch surfaces like doorknobs, kitchen areas, and bathroom fixtures. Do not kiss or share food with babies or children you are caring for. Caregivers must only work with one family at a time to minimize exposure. Advise your caregivers to remove their shoes and change their clothes and also wash up when they return to their own homes. This will help to decrease cross-contamination. Caregivers also need to watch for any symptoms. During this time, caregivers should also monitor themselves for a temperature or any other symptoms before caring for your baby or children. Check the baby or child's temperature twice a day and watch for symptoms of COVID, such as fever, cough, or shortness of breath, or other symptoms that we talked about with the babies that are specific to children and babies. If the child develops symptoms, call the child's healthcare provider for medical advice and follow the steps for caring for someone who is sick. If possible, the child should stay away from people who are at higher risk for getting very ill if they are positive for COVID. Limit visitors to see your baby. I know this is a tough one. The birth of a new baby is a significant life event that typically brings families together to celebrate and support the baby and the new mother. However, before allowing or inviting visitors into your home or near your baby, consider the risk of COVID-19 to yourself, your baby, people who live with you, and visitors, grandparents or older adults, and other people at increased risk of severe illness from COVID. Bringing people who do not live with you into your home can increase the risk of spreading COVID. Some people without symptoms can spread the virus. Limit in-person gatherings and consider other options, like celebrating virtually for people who want to see you and your baby. If you do plan to have in-person visits, ask your guests to stay home if they're sick. Ask them to stay at least 6 feet away from you and your baby, wear a mask, and wash their hands when visiting your home. What do you do if your family or friends are flying in to help you? Well, here's what we know. The CDC recommends that they take steps to reduce higher risk activities for 14 days before their trip to see you and get tested 1 to 3 days before their travel. This could help reduce the chance that their travel will be interrupted or delayed by COVID. So they want them to get tested 1 to 3 days before their flight, then get tested 3 to 5 days after they land from their flight, from traveling, and stay isolated for 7 days after travel. So whether that would be isolating in a hotel for a week before they came to help you, or isolating in a separate part of your house, as if they were someone that was sick in your home and you isolated them to a certain bedroom, used their own bathroom for 7 days before they were able to help you. Get tested 3 to 5 days after travel and stay isolated for 7 days. Even if you test negative, stay isolated for the full 7 days. If you do not choose to get tested, it's safest to stay isolated for 10 days after travel. Always follow your state and local recommendations or requirements related to travel. Some travel airlines are requesting, especially international airlines, are requesting proof of negative results. So you want to make sure that you check what are the rules and regulations with that airlines and the state they're coming from and the state that they're going to stay with you. Delay their travel if they're waiting for test results. Isolation. Who needs to isolate? people who have symptoms of COVID and are able to recover at home, people who do not have symptoms but have tested positive for COVID. Isolation is used to separate people infected with COVID from those who are not infected. People in isolation should stay home until it is safe for them to be around others. At home, anyone sick or infected should stay alone in a specific sick room or area and use a separate bathroom if available. Do not share personal household items such as cups, towels, or utensils. People in isolation should wear a mask when leaving their room or sick area. Others who must enter the sick area should also wear a mask. While in isolation, it is important to stay in contact with your social network. Use calls and Zoom to stay connected with your family and friends. Quarantine or isolation, what's the difference? It's going to be really confusing. It was for me. So as the last slide said, isolation is for someone who has tested positive, whether they have symptoms or not. Quarantine is for people who have been in close contact with someone who has COVID. What counts as close contact? You were within 6 feet of someone who has COVID for a total of 15 minutes or more. You provided care at home to someone who is sick with COVID. You had direct physical contact with the person, hugged or kissed them. You shared eating or drinking utensils. They sneezed, coughed, or somehow got respiratory droplets on you. What should you do if you've been exposed? Notify your doctor, stay home, and monitor your health. Tell your close contacts that they may also have been exposed to COVID. An infected person can start to spread the virus starting 48 hours or 2 days before they have any symptoms or test positive. CDC recommends you stay home for 14 days after your last contact with a person who has COVID, due to the fact that symptoms can develop 2 to 14 days after exposure. When is the best time to get tested if you've been exposed to someone? Now they've found that 3 to 5 days after you've been in considered close contact with someone that has positive COVID, 3 to 5 days after that exposure is the most accurate time to get tested. If you have symptoms, the test results will be even more accurate. Children staying in the home with the sick parent or caregiver. If a child needs to stay in the home with you, if the parent or caregiver is sick, both you and the child should wear a mask while in the same room. Note that masks should not be placed on children younger than 2 years old. Anyone who has trouble breathing or is unconscious, anyone who is incapacitated or otherwise unable to remove the mask without assistance. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer containing at least 60% alcohol and rub your hands together until they are dry. Try to stay 6 feet away from the child if possible and if safe. Increase ventilation by opening a window in a room that you are in. Disinfect any items that you need to bring to the child. Do not disinfect food that you bring to your child. How do I explain these circumstances to my other children? This is a tough one. So, step one, things to help: overcome silence. Children are intuitive observers, and as adults, we often don't give them enough credit for their way of being in the world. With that said, as the adult in the relationship, it's our responsibility to modify our communication style to the appropriate level of our children, especially their age. Plainly explaining to your children what a virus is and how they are transmitted will help to explain why mommy and baby have to be kept at a distance for a short time. If you find starting the conversation to be overwhelming, there are plenty of children's books on Amazon that can be a helpful conversation starter. Step 2, welcome emotional exploration and expression for both you and your child. If you take the time to pause and check in with yourself, you avoid the risk of becoming swept up by your emotional experience. As a result, you'll be able to be fully present when your child and help them to explore and express how they feel about their circumstances, whatever those may be. I think this is it's a tough time for everybody, but I really feel like it's such a tough time for children when they're in that range of, I understand some, but not all. And it's so scary for adults, and it's really scary for kids too. And I don't think we give them enough credit. So how strong they are in getting through this. And that information was from Brittany Williams, a family and marriage therapist through Healthcare in San Francisco. Children staying outside the home with a temporary caregiver. CDC recommends if the child will stay outside of their own home with a temporary caregiver, the new caregiver should help the child to quarantine and do the following. The child should stay inside the caregiver's home until 14 days after their last close contact with the sick person. Watch for symptoms. During this time, the caregiver should monitor themselves for symptoms and practice everyday preventative actions. Check the child's temperature twice a day and watch for symptoms of COVID, such as fever, cough, shortness of breath, or symptoms specific to children. If the child does develop symptoms, call the child's healthcare provider for medical advice and follow the steps for caring for someone at home. If possible, the child should stay away from people who are at higher risk for getting very sick from COVID-19. The caregiver should then quarantine for 14 days after the last day the caregiver had contact with the sick child. Even if they did not have symptoms, they still could have COVID and the caregiver could have been exposed. So what can we do? Well, exploring the outdoors while social distancing. Get out of the house. Nature is all around us. Exploring outside with proper social distancing can happen in your yard, a tabletop garden, or even virtually, though not with all of the benefits. Bringing your baby outside. Even infants and toddlers can play and learn in nature. If you will be in a public area like a park, it may be safest to keep them in a carrier or a stroller. If they are in your own private space, it's fine to have them explore even more. Take story time outside. Grab a blanket, some books, and find a shady spot to read with your children or babies outside. Pick books that talk about nature and help your child make connections. Should I get the vaccine if I'm breastfeeding? The CDC recommends, explains that there's just not data yet on the safety of COVID-19 vaccines in lactating women, or on the effects of the mRNA vaccines on the breastfed infant or on milk production excretion. The mRNA vaccines are not thought to be a risk to the breastfeeding infant, but you need to talk to your healthcare provider. Now, even moms that are positive for COVID, doctors are having them breastfeed, wearing a mask, washing their hands. And at this moment, they believe that it is safe for moms to breastfeed their babies, even if they have tested positive for COVID. But getting the vaccine while you're breastfeeding, it just is not enough research done. So people who are breastfeeding and are part of a group recommended to receive a COVID-19 vaccine, such as healthcare professionals or high risk, may choose to be vaccinated. So talk with your healthcare provider. They're going to talk to you about the risk and rewards of, if you're in a high risk field where you work, or your community or your house. Is it safer for you to get the vaccine while you're breastfeeding? Or if you're in a very low risk job setting, community, home setting where people aren't working or being exposed outside, they may recommend that you wait until you're finished breastfeeding to get the vaccine. So it's really important to talk that over with your healthcare provider. It's up to you. No matter what you decide, it is important that you continue to follow COVID-19 infection prevention steps by wearing a mask, washing your hands frequently, maintaining physical distance of at least 6 feet, and avoiding large gatherings. Thank you. Thank you to my sister, Pat Pori, a certified postpartum doula, licensed professional counselor, best-selling author, online course creator, parent educator, and co-creator of this presentation. Thank you to the CDC for providing up-to-date recommendations. Thank you to Brittany Williams, our marriage and family therapist, Oath Care's resident expert. Here is her email if you would like to contact her. She's amazing. Oath Care is an onboarding for motherhood. Oath builds out a complete support community for you, bringing medical providers, like-minded peers, and a trusted facilitator together in an intimate chat group. Sign up on the wait list and get your first month free with the code don'tmomalone.oath and their website.
That's great. Pam, terrific. Thank you so much. Such great, great information. And I love that. Don't mom alone. We're going to transition into our question and answer time now. And so please, type whatever questions you have for Pam, and I will make sure that she has a chance to address them. But before we do that, I just wanted to provide you with some contact information. How to get a hold of Pam. Again, she is the founder and owner of Sweet Dreams Little Ones Traveling Sleep Agency. Her email address is right here, pam@sweetdreamslittle.ones.com. I invite you to like and follow us on Facebook. Our Facebook page is Raising Confident Parents right there. And I also invite you to join us on your parenting journey and learn what to expect during pregnancy, how to prepare for delivery, and what to do once the new baby comes home. And hope you'll join us in our Raising Confident Parents online course and community. So type your questions in, and we have some that we can kick things off with that came in, and lots of questions related to vaccines. I think there's just such an interest there, and a need for clarity because there seems to be a lot of conflicting information out there. So when we covered this question in our first webinar, but I'm going to bring it up here. When you're pregnant, should you get the flu shot and the Tdap vaccine. Is just,
Yes,
yeah, okay,
absolutely. Yes.
okay. So
If
does
you
that
feel
include,
better not getting them at the same time, you can spread them out a few weeks.
okay,
A lot of people do get them at the same time, but you don't have to if you're pregnant and not comfortable with it. But you definitely want to get the flu shot and the Tdap shot for whooping cough.
oh, whoopee cough, okay, great, thank you. And then someone is asking here about the loss. Is that really, safe to say that if there's a sudden loss of taste and smell, that there's a pretty good chance you're infected? Is that a fair assessment?
Yeah, it is. I mean, to this date, there isn't really anything else that causes, a distinct complete loss of taste and smell. You can have a sinus infection, you could have a cold, and you may not smell things as strongly, or if you have a sore throat, you might not taste things exactly how you did. But if just you have those symptoms, or you have no other symptoms, and you just can't smell or taste, you need to be tested, and you need to be away from other people in quarantine until you get your results.
So is it really true that it's a very sudden onset? Does that happen very quickly? I mean, like from one day to the next, literally, you're like, oh, I think I have a problem.
The people that I have known that has been their only symptom has been been fine and woke up the next morning and couldn't smell their coffee.
Oh, wow. Okay, thank you. So definitely sudden onset. Okay. Um, what are some warning signs of an emergency? So just again, I know you talked about this in your slides, but it's coming up again. Can you just reiterate what some of those warning signs are? When should you
Sure.
really be concerned to get and seek
Yeah.
help?
So, I mean, if you have, adults, if they have a high fever, I would definitely call the doctor. 104 fever is really high for an adult, especially if it's not coming down with alternating, Tylenol and Motrin. If there's any difficulty breathing, if anyone becomes really confused, and these are adults, right? Adult warning signs for an emergency right now. But they all of a sudden they can't focus. They really become confused and are really having difficulty breathing. That's when you definitely want to get them to the hospital as soon as possible. Call 911, tell them that they have these symptoms. They may have been exposed, or they may have COVID. So again, the paramedics can be prepared when they come to your house. If you're looking at a baby, if the baby has been fine and all of a sudden won't wake up to eat, even after 3 to 4 hours, you're trying to wake them up. They're kind of lethargic. Their arms are kind of like noodly. They're having any blueness around their mouth. That goes for an adult also. But if babies are just not eating well, if they're having any difficulty breathing, if you open up their shirt and you see when they breathe in, the skin under their ribs kind of gets sucked in and then comes out, or you see that they're breathing like very shallow rapidly, those would be all signs. High fever with a baby, any fever with a baby, you want to get them checked out.
Okay, great.
uh,
Thank you.
Anything.
We've got actually a question here. This is from Kimberly. Um, it's not COVID related, but she's asking a question. Is it normal to have pelvic pain at 27 weeks? It's very painful and uncomfortable.
Yes, that's when the baby starts moving down and can, even be head down and cause a lot of pelvic pressure. The baby could have his head turned the wrong way right now, which causes even more pressure. But so that is not uncommon, depending on how your pelvis is shaped. Or you can have a lot of pressure on your tailbone, on your back. I would recommend, staying off your feet when you're really uncomfortable, elevating your legs above your heart, using some heat or some ice, 20 minutes on, 20 minutes off. You can take a little bit of Tylenol when you're pregnant. You don't want to take any Advil or aspirin. The heat will probably feel comfortable, but yeah, some women with their first, or even more so with more pregnancies, as those ligaments get looser, they will even have more pain, feel like the baby is certainly falling out in the grocery store. Or even with your first pregnancy, a lot of women have that pelvic pain, and it's actually like ligament pain, but it's low in your pelvis, and it is like stretching ligaments because your uterus is growing, and it can be, very uncomfortable. But make sure, if you're having any bleeding, having any constant pain, that could be contractions, that are coming frequently, or, any leaking of fluid, make sure that you call your doctor. If it's just, I don't want to say just because it is uncomfortable, but if you are having pelvic pain without any other symptoms, then I would do comfort measures and let your doctor know. There isn't too much more you can do, but they do sell something that might help, because if you're 27 weeks now and you're having pelvic pressure, it's probably going to get worse the bigger your belly gets. So they do have some like belly support belts that kind of help to hold the support of your belly to kind of get some of that pressure off. And always make sure when you're laying on your side that you have a pillow supporting under the side of your belly to give you some support, so it's not hanging down and causing more pressure.
That's a great answer. Thank you. I think Kim, that's some great information for you there. And another question came in on this. Yeah, and you touched on this. How to deal with parents and close family that want to hold your newborn when you are not comfortable with more than having them see the newborn from 6 feet away.
This is a time where you just really have to, draw a line in the sand. Being grandma myself, I would be so sad, but I totally would understand. My grandson was born in January, so this, came up in March, and I didn't go by him in March. I stopped taking in-home clients. I social distanced. I wore masks. So even, it was very, very hard because, of course, everybody, especially grandparents, want to hold the baby. But, it's that risk reward. Right now, this is a totally different time in life that we've never experienced before, and hopefully will never again. So, the parents, grandparents, they have to be understanding that, this is your wishes, and if they've planned on coming in to help you, like I said, that's great, because I really want parents to get as much help as possible. But if they really want to be safe, they should follow the CDC guidelines. And and if they do that, then the parents may be more comfortable with, if that's someone that's going to be staying with them for a month, to help them take care of the baby. Then after their 7 weeks or 7 days of quarantine are over, they may feel much more, and they're tested negative, they may feel more comfortable. But, myself, I still always wore a mask. I wouldn't hug them for a very long time. And I was self-isolating myself just so that I could see them from 6 feet away.
Exactly.
So it's just a really scary time when you're thinking of a new baby. I just kept saying, I am not the one that is going to get those babies sick. It is not going to be me. And thank God, knock on wood, it's been a year, we're fine. But, it's a different time for everyone, and we all have to adjust. And we have to make the changes. We have to do this, to all of us, to get rid of this vaccine and go back to our normal lives. But if we're not all doing what we're supposed to be doing, then as my granddaughter who's 7 says, this sickness is never going to go away. She says she's going to go talk to the president and make sure that he makes everyone wear a mask.
That's really so sweet. Well, again, there's so much, to your point, there's so much information out there, and everywhere you look, every website you go to or Google, and you get conflicting information. So that's why we appreciate, your expertise here and experience, and kind of setting us straight on what's important, and how we can protect ourselves. So thank you for that. Want to just ask a question. This is kind of an interesting question. I know that you talked about children should not wear a mask if they're younger than 2 years old. Is that correct?
Correct.
Okay. What about what's the benefit of wearing a face shield, or wearing a mask? I see, we're all out there and about. We see people wearing both. What's the thinking on face shields instead of masks?
Well, you don't want to wear a face shield instead of a mask.
Okay.
If you want to wear a face shield, you wear it with a mask, and it just provides, I believe, you more protection, because the droplets, if your nose and mouth are covered by the mask, your eyes are still exposed. And so if you have the face mask on and somebody like coughs right in your face, hopefully it's going to stop the droplets from, going in your eyes and possibly infecting you.
Okay, great. Thank you for clarifying that as well. And then a couple questions about, you have a couple additional webinars coming up in the next couple of weeks. Can you just talk a little bit about what's coming up and what people will learn?
Yeah, so the next one, we really want to focus on, people that have been in isolation. Even if you haven't been exposed or you haven't been sick, the last year has been pretty isolating for everyone in some way. So we just want to talk about, different types of isolation, what everybody's kind of going through, especially, during this time when, you're either pregnant or you're having a baby, or, the visitors wanting to come, and what that really is doing to all of us emotionally. Depression, anxiety, the suicide rate is up, child abuse is up, domestic violence is up. And it's awful. So we really want to try and focus, the next one on, how can we help each other? How can we support each other? How can we support ourselves and our family? And just try and maybe give some tips and advice. And, like all these have been, we really wanted to just make sure, when we talked about adding an 11th chapter to our online course, we really wanted to make sure that parents or expectant parents and families, knew that they weren't alone, and that all these people that are going through this in different ways, that, I hear you, I see you, and I understand, having been pregnant myself, having been a nurse for 25 years, working with moms, delivering their babies, how some of the things have changed as far as, partners in the delivery room, and, visitors, and so many things that have changed. And been, through all that, I can understand the changes. So I can know, I can really understand what the moms are going through with the delivery. And, we really just want to be there to support you, try and give you tips, and get away from all of the information that's out there. Anything that we've used on these webinars came from the CDC, World Health Organizations, or professional doctors or therapists. There's nothing off other websites because there's thousands, and we wanted to make sure that all information, although it changes even on those websites very often, we wanted someplace to, be able to have those answers for you, hopefully in an easy place, and easy to understand, but they're still confusing. So if you have questions, even after you get the recording, you're able to stop it and make notes. Just email us, and we're happy just to be an ear, and just know you're not alone.
Wonderful, wonderful. Thank you. Well, if you bring me to the last slide, then just wanted to give everybody the information about our next webinar. So here we go. So the next, the ones that Pam just spoke about, February 24th is isolation and anxiety. And then on March 10th, Pam will be addressing the vaccines, yes or no. And again, all four of these webinars they're all recorded. And so we had our first webinar was on pregnancy and staying safe. As Pam said earlier in her introduction, it's available to anyone who would like it. You can certainly contact Pam or go to this URL here at the end of the page here, smbdigitaledu.com. And we'll absolutely make those available, all four of them. And, take your time with them. There's a heady information here. Good science, great practical experience coming from Pam and her experts. So, Pam, any closing remarks you'd like to leave everybody with tonight?
I'm so glad that you took the time to and come and watch, and to be educated and share your education, share the webinars with other people. There's just so much misinformation out there, that we just want to make sure that it's clear. And if you have questions that you really want need answers for, if you have the questions, probably a lot of other people do. And that's how I started these webinars, I was asking myself questions, writing down questions, the questions that I would have if I was pregnant. What would I want to know? And there was so many just in my head. And it's the same thing with bringing the baby home. And, isolation can be confusing, when to get tested. And so those are things that are important, because even, I was given misinformation about when to get tested after exposure from a doctor. And so then when I started doing research and found out I wasn't even tested on the correct dates after I had exposure, I thought, if this is all happening to me, this is happening to a lot of people. And so I just think it's really important that, we all, we're all in this together. And even though it's affecting everybody in different ways, everyone has to support each other and do whatever we can to lift everybody up, and, educate people, and know it's not a hoax. And I'm sure those 400,000 people whose families have been affected by the death of a loved one, would certainly not like to hear that people still think it's a hoax, that they don't want to wear a mask because it's inconvenient. Um, it's just so important. And if we can just all stick together a little while longer and do what we have to do, we can get to the other side of this. But we just all have to do it. And no one likes it, and it's not easy, but we all want our lives back. And so just if there's any takeaways, we're here if you need anything. If you know that you have questions already over the next week that you want answered about isolation, different anxieties, if you're having situations at home with your kids, with depression, acting out, anything that you know you would like the answer to, you can email us. We'll make sure that we have those answers to those questions on the next webinar. Questions about vaccines. It's changing daily, and who should get it, what's the risk and reward of getting it at certain times, if you're breastfeeding, if you're pregnant. So those things are going to change, but if you have questions that ahead of time, we want to make sure that we can answer any question that you have. So please feel free to email us anytime.
Great, Pam, thank you. And actually, we have another question that just came in, so I'm going to uh, ask you to answer this. It says, will you have resources on finding local and non-local virtual pregnant women and new moms support groups?
I will now. I'm going to write that down, and I will have it for the next webinar. See how that helps me, because that's a great question. And I'm sure they're out there. Just take some research, and we'll find out where they are. And if there's not, then we need to start one, because people that have been affected need support, and no matter how they've been affected, whether it's their business, their jobs, their families, losing a loved one, everyone has been affected by this virus, and everyone needs support. You don't have to do it alone. You don't have to be alone. And I will definitely research some support groups.
Sounds great. Thanks.
Thank you.
Thank you again, Pam, for that, and for that great question. Well, that brings us to a close tonight. Pam, thank you for your closing remarks, and thank you all for being with us. I'm Deb Dietz of SMB Digital Education, and we hope to see you on February 24th and March 10th. Stay safe out there. Bye for now.
Thanks so much, everyone. I really appreciate you coming, and sweet dreams always. Pam.
Take care.
Bye-bye.